Good afternoon, everyone. My name is Simiran Chaudhary, and I welcome you all on behalf of Voice of Healthcare to a special podcast series, Immunity Talks Protecting Public Health. This podcast series is dedicated to raise awareness and promote critical importance of vaccination in safeguarding public health. As we dive into the discussion today, we aim to highlight the latest advancement, challenges, and the strategies in immunization, all while addressing the barriers to achieve widespread vaccine coverage. This year's theme is Immunizing Protecting for Future, which resonates deeply with our mission to ensure that every individual, regardless of age or background, understands the vital role that vaccines play in preventing the spread of infectious disease and protecting our communities. Today, for the episode, we have with us Professor Dr. Sunit Chandra Singhi, who is Head Pediatrics at Amrita Hospital, Faridabad. Welcome to our show, sir.
Thank you.
Before we proceed, I would just like to give a brief introduction about our guest today. Professor Dr. Sunit Singhi is a pediatrician of international repute. He was the head of Advanced Pediatrics Center PGI Chandigarh for over 33 years, chairman of pediatrics at Medanta the Medicity for 5 years, principal and head of department at Institute of Medical Sciences Ambala. He established India's first pediatric intensive care unit and first postdoctoral DM courses in pediatric critical care. He is ranked among world's top 2% medical scientists by Stanford University. In recognition of his work, Dr. Singhi has received ICMR's Amrit Moody Unichem Prize 2010 for Child Health, the National Academy of Medical Sciences KL Wig Award 2013, Swasth Bharat Samman 2011, Claris's Critical Care Oration Award 2003, and Lifetime Achievement Awards, Medals, Oration, and Best Paper Awards, amongst many more. He has also been part of smallpox eradication program and piloting program of measles for 1984. Welcome to our show, sir, and it's an honor to have you with us.
Thank you, Simran, for all those kind words and a long introduction. I'm really pleased to be here, and if I can help increase the awareness about the vaccines and motivate few more, I would be really happy.
Thank you for that, sir. So, starting with a conversation, we know this time which is evolving a lot with new infection every day, new disease every day we are hearing of. Like recently, mpox is the new hot topic which is going around in our healthcare industry. So, given your extensive experience in pediatric care, can you discuss the importance of vaccination on childhood and why childhood immunization is a critical foundation for child's long-term health?
Sure. I think it goes without saying that vaccination is the most effective, cost-effective intervention and the simplest of those public health measures which can not only save lives but makes economic sense. Healthier children with vaccine will prevent disease, give immunity to the children against disease. That and widespread vaccination will create herd immunity, what we call. That herd immunity is general protection of the community from the disease. Then if you are healthier, there is disease protection, then there is also better growth and better physique, so which is ready to fight more diseases, healthier. So it's healthy foundation. On top of it, vaccination not only prevent disease, but therefore decrease the mortality. So many child lives have been saved in last 3 decades since we have come up with the universal immunization program, and before that. So decreasing mortality, decreasing incidence of disease, making healthier children, and so a healthier society for tomorrow. I think vaccination is the best, most effective intervention, I would say.
You said it right, sir, because it helps in decreasing the mortality rate.
and beyond, and
Yeah.
beyond. Because if children don't fall sick, they continue to eat well, they continue to grow well, and they have actually a foundation for better health. And vaccination then again build up the immunity for tomorrow. And when they're exposed to the next vaccination, they are even stronger in fighting that disease. We know from old time that how bad things used to be in relation to so many infections. We don't see those diseases now. That's what vaccination has done. You know about smallpox eradication and polio eradications, and
Yes.
all that had happened just because of vaccinations.
And so we, like you just mentioned about smallpox eradication and polio eradication, that deserves applaud for all the people who were involved in, and you were amongst them, who helped our nation to come out of it. And somewhere, some around, your contribution had made it possible, along with all our team, all our healthcare industry people. So thank you so much for that.
Just one of them.
So
There's a whole huge team.
yes, so there so we know that how important is immunization and vaccination, because of our so many universal programs that are reaching to the masses, reaching to our corners of our country. Like in the previous term, our current health minister, Shri JP Nadda, launched Mission Indradhanush, which was to cover or reach for the immunization for the maximum diseases which people are not aware of, to get rid of those diseases, and each people can have the shot of vaccines which are available for our country and essential. So there are many key challenges that people encounter, or missions like this encounter. And to ensure the maximum coverage, there are many problems we face. So what do you think, what are the more major challenges that people or the government faces, especially in rural areas or underserved areas?
So vaccination, ever since it had started, there had been barriers, and the early stages, the immunization coverage was just a meager single-digit coverage, single-digit percent, 5%, 10%, and it has gradually increased. So we know how to overcome those barriers. We know those barriers, but to overcome those barriers takes time. And the most important of them initially were the cost, the accessibility, the cost of vaccine, affordability for a whole country.
Hmm.
When we introduce a vaccine for the whole country for today, that for 27 million children born every year, if you want to cover them every year, you need huge resources. So that cost had been always and it remains a challenge for introduction of newer and newer vaccines. But I must say that the current government has really pushed vaccination programs so well that in that I think in last 7 8 years we have introduced several new vaccines and very quickly national, spread it all over the country. So one is an economic challenge, and that is of course the governmental level. But another is public, at the
Hmm.
people's level. Accessibility also is an issue. Sometimes vaccines can't be reached to a person who is in the remote area, vaccinators. So then vaccines are available in more easy to access areas. That need to be really addressed and taken care. Then the issues are related to understanding, the information. There are many situations where vaccine is available, and yet people are not taking it. It's because of their beliefs. I know that I know once we had a child coming with diphtheria in our emergency, and we asked, "What about the other children?" He said, he has two more children. We got We asked him whether you have got them vaccinated with DPT. He said no. It turned out that he was himself a medical practitioner of a different kind.
Okay.
And all the three children finally developed diphtheria. That's the kind of sad state. There are also religious beliefs which come in
Hmm.
the way. There is a suspicion that the government may be putting something dangerous there. And in 1975, when I had been involved with the smallpox eradication program, and I was working in Bihar, I would go to the villages to vaccinate those people, and they will all disappear in the field, and nobody will be found at home. I tried to figure out what is it, and they had apprehension that these vaccines can harm them in the long term. So there is clearly information which need to go to them as what you are doing, letting people know that they are good for you and there is no harm attached with it. There is no harmful substance in it. These are very common issues. Then, of course, we had a gradual introduction of the vaccine because of the economics, but at the individual level also. Some of the vaccines are not yet in the government program.
Hmm.
These are available in private for a price. People are not able to afford many of them. So in private hospital, of course, we are able, people who come, we prescribe and they get. But I must again compliment the government that most of these vaccines are now gradually getting available in the government system. So we have barriers and challenges. We have also misinformation and myths, but we need to increase our awareness program repeatedly, get to the people and let them know that this is the best that they can do for their children. Then on top of it, this time COVID created so much of havoc. It's not just the endemic, the pandemic killed many and maimed many, but also for children it had been a disaster. The vaccination coverage had gone down. So any of these emergencies, disasters can affect the immunization program. And that again we need to address in some way or the other, where international help is also available and we can do it. But I must say that over the years we have come over most of these challenges. Now there are more acceptability for vaccination than what it used to be, let's say 30, 35 years ago.
Said it right, so and the kind of misinformation that is out there in the market is a lot, and sometimes it gets very difficult. You just explained one example that when you used to go to Bihar for the vaccination program, people used to disappear because they have this kind of fear that this will harm their body. And still, when you mentioned about COVID, I knew few people in my circle that they say no, we have not taken that COVID shot because somewhere it is going to affect our immunity. We will not be that strong as we were earlier. And I met some people who said, who are into this naturopathy kind of people, because I'm into this healthcare. So I've met so many people into this naturopathy who says, no, these kind of vaccinations are not required. Earlier, if you could go about the previous generation or somewhere around back in time, these vaccinations were not there. People were healthy, happy, with this kind of life they used to live and everything. But I don't know why. It's my thought they're not understanding that how times has changed. Things are evolving.
In in fact, those are the misconception. In olden time, 120 of 1,000 children would die. Now, now it's just 20. So
Yeah.
one has to understand that infant mortality has been reduced by, it's just to 20 now out of from 120 these years. A lot of contribution has gone from the vaccination to provide immunity. So those who are advocate of nature and natural immunity, they are also then advocating that we remain with all these diseases amidst us, which can be eradicated or which can be controlled with vaccination. So
Yes.
this is another misconception. And then there is a myth that had been spread, mostly coming from the West, that it can cause autism.
Yeah.
25% of people in US believe that vaccinations cause autism. So how can you help it? There's only one way: education, awareness again and again, and let them know that what is vaccination has done. We used to see so many children dying of tetanus and diphtheria. We hardly see anymore because of the vaccination program had gone. So one has to continuously bombard, if I would use the word, this information that there is nothing better than vaccination to prevent the diseases. For whichever disease the vaccine is available, it's worth it. It may not be checking or preventing 100% of the diseases in 100% of the people, because there would be other factors related to the population, related to the person, their immunity development and all. But it works in 90 to 95% patients. The 90 to 95% people, if they are protected, if they are not, if disease is not prevented, at least the severe complication of disease are prevented. Like what happened with COVID.
Yes.
It made COVID mild. That's what we all believe now. Vaccination didn't prevent the spread of the disease, but it still reduced overall morbidity. So there are advantages of all levels. Of course, extreme is that the lives are saved, but at the lower end is also that even complications are saved, the hospitalization is saved, the overall health is preserved without being adversely affected. Those are all the information that people have to get. And also, some of the health related messages must go more strongly, that if you really love your children,
Hmm.
you need to get them vaccinated. Something which make an emotional appeal. So
Exactly.
information in an effective manner, one in which I am not an expert, but I know that people, if they are told in a way, it makes more impact. So we should work on that.
So you said that education, educating public about this is the most important thing, and that's how we can aware and spread awareness amongst public of our country. But if specifically a healthcare professional has to address this effectively, or the patients they came across, or the new parents, because the child immunization vaccination is the most important thing to build a future of our country. So how can they address and advocate about immunization and vaccination to the new parents?
You mean to say we as pediatrician, healthcare worker,
Yes, sir.
okay, I think that's the easiest part that I would say.
Okay.
When a person has come to you for seeking health care for children or for himself, that's the best time that they are receptive to your advice.
Mm.
And I think I had been talking about it for a longer time than the question that you asked. That every opportunity, every encounter when we are seeing a child with a parent is the time to inquire about the vaccination, whether they have got it or not. It's good to review if they have a vaccination card, that what they have received or not, and then emphasize upon them. If they have received all, then compliment them, say them that you are the best parents who could be. And if someone has not done, then bring out to them that this is, say you have not got a child vaccinated against diphtheria, pertussis, tetanus. Would you like your child to suffer all these diseases? No, nobody wants. Do you want your child to be lamed because of polio?
Mm.
So these messages can be very clearly given to them. And now pneumonia vaccine, vaccine for meningitis, vaccine for dengue coming up, not yet,
Yes.
but the day it comes, they would definitely take it, because they also know that these diseases are bad. They can kill. If they don't kill, they leave the children disabled forever. The JE, Japanese encephalitis vaccine, for example, in endemic area of their country. So all of them is a part of every health worker who is prescribing something to the patient. It is also the time to discuss, review, and emphasize upon them the need for vaccination and how it will protect their child from the disability and disease and death. And if we can do it, every one of us can do it, then I'm sure we have reached everyone. We will be
Yes.
able to, and we will be able to remove those myths. They will say naturalist. We have ways to explain to them it's not the natural immunity. Had it natural immunity been good, we wouldn't have been losing so many children in the past. We have saved millions and millions, 35 million children in last 30 years because of vaccine alone.
Mm.
So healthcare workers certainly have a way to go about, and they are the most privileged position to help the country and the population in accepting vaccination and its role in their life and saving their health and making them healthy.
Thank you so much on that, sir. Thank you so much for explaining how we can more spread more awareness on it and educating our public. And having held leadership roles in international pediatric critical care societies, could you share your insights on how global collaborations has influenced childhood immunization programs, particularly in developing areas, as we still know there are many other countries who are still suffering with many bad diseases, infectious, and they're losing most of their people because of that only.
Well, I think I didn't have to be part of the global uh, programs necessarily, but look at the vaccination program. The
Hmm.
vaccination program has come in the being only because of the international collaboration. It was WHO initially and UNICEF that came
Hmm.
out with that program, what we called EPI or Extended Program for Immunization, which was modified or expanded to call EPI, Expanded Program of Immunization, which started with 6 diseases initially, but then continually adding more and more. All of them came because of the WHO suggests the EPI, the EPI, and then the Universal Program of Immunization before they were introduced in our country. So they formulated the program, talked with the concerned countries, and then got them going. The resolutions were passed in WHO Assembly that these are the vaccinations, so these will prevent the diseases. And initially, the DPT, polio, uh, typhoid, and one more disease. Six were introduced. After that, we expanded them. So, and from time to time, after that, that universal immunization program, and then came alliance. That knowing that although the program had been introduced in various countries, globally it was going slowly. Then they came again together up with Gavi, that is Gavi Alliance for Vaccination, and then WHO and UNICEF. It's particularly UNICEF and WHO had been partnering the immunization progress all over the country and came up with another program which then caused this UPI, yeah, Universal Immunization Program.
Yeah.
That took vaccination very rapidly down to the various populations in low and middle income countries. So, the global organizations had been, in fact, behind success of most of the vaccination. They were helping national governments with vaccine availability, supply chain, helping creating vaccine. Country like India could not probably import so many vaccine. We produce actually maximum amount of vaccine and
Yes.
export it to the lot of countries. But all of that happened gradually,
Mm. Yes.
and this was the like when pneumococcal vaccine came, for example, the Gavi initiative, along with the rest, brought up this. There were a lot of discussions in the government, Indian Council of Medical Research, and then the government. And finally, before introducing, it was decided that we go in a phased manner because of the getting the vaccine, getting to so many people, and over the time, how can we reach everyone? So these the vaccines that had been introduced in the later part, especially in the last 7 8 years, they were all operationalized from few states. Then we have gone nationwide, like pneumococcal vaccine, as I was mentioning. From 2012, 2011 to 2007, or to 2015 to 2019, most of the vaccines have been introduced in that manner. So to even needed to address the supply chain, the availability, reaching people, that population, and adding the work over and above already a vaccinator was doing. So getting a bigger, better team, getting more
Yeah.
health workers for this purpose, all of that is required. And there, of course, the local expertise is needed, but the push for it, the collaboration had been very helpful in planning these strategies. So, the smallpox eradication program is a very good example of it. People forget that. But I worked with epidemiologists from US as well as Russia, that USSR at that time, other European countries. The the program chief medical officer from WHO was a US citizen. So this is the kind of global collaboration has always helped. Polio eradication.
Yes.
Almost every country from developed to developing ones is involved. Of course, the country which is where the program is running would be implementing it, but health communities are also involved in implementing it. So that's where the international collaboration has been helping ever since the vaccination programs have started.
And you mentioned it right with great examples that without the international alliance, without international programs and support, it won't be possible across our countries, small continents, which or developing countries specifically, those who are still suffering or were suffering with such kind of diseases and shortage of vaccinations. But yes, with those kind of support programs and alliances, we have eradicated somewhere or the more polio, measles, smallpox, and we are able to do that. We were able to do that. But sir, looking ahead, what are your hopes for the future of childhood immunization in India? And what steps do you believe are necessary to ensure every child is protected? Because we mentioned few of the things which were a problem, a disease, a big problem in our past, that was smallpox, polio, measles. People and parents are aware of tetanus, and somewhere around it depends upon the education and awareness programs which are going around. But there are many other vaccinations. There's a list of vaccination which a child gets when according to the schedule, but people do not do that. Some is hepatitis and vaccination programs. So what steps can be taken to ensure every child is protected?
Right. Hepatitis B is a program which is already taken up by the government of India
Yes.
nationwide. Also, the injectable polio now,
Yes.
measles and rubella, of course, MR vaccination program, part of measles strategy, and pneumococcal.
Yes.
They are all. So here we have already reached most of the population. Of course, a setback occurred because of COVID, that
Mm.
the children were not brought for vaccination and healthcare facilities were preoccupied with many with COVID. That bigger challenge right now is actually to uh, cover that gap that has occurred, catch up vaccination to this population. Every day in my practice, I'm seeing children who had missed a 1 year dose or the doses for it. for a whole 1 year where the vital vaccinations were to be given. And we
Yes.
are trying to do the catch up. But there is a need for campaign
Hmm.
to inform them that if you have not got your vaccinations done, please complete them now.
Yeah.
It's not that they are one time and that 6 months old or 1 year old have got, is needed only for them. It's for the whole life. Diphtheria can occur if there is no vaccination given today in young adults. We had epidemics of this kind of disease in Europe last decade. Whooping cough. Whooping
Hmm.
cough is being given, that part of DPT. If it's not being given, there's a whooping cough epidemic that had come up. Measles, we had a sudden flare in measles in this country with very much, I mean, very small drop in the vaccination program because of the COVID again. So last that survey 5, showed us that we are now getting back to a better immunization coverage. But in between survey 3 and 4, there had been a small drop of 6% in measles vaccination, and that resulted in 40,000 odd cases extra over and above. So there is clearly need for bridging that gap or catching up, as we call catch up vaccination, in those population that has been left out because of the pandemic. Then reaching those, getting those vaccinations which are not yet available to general public, where I would say that the government is really earnestly doing this, and the policymakers, they are aware of this. That's how we have been able to introduce JEI, in injectable polio, MR campaign, and hepatitis B. But then there are also hepatitis A. There are again the cervical cancer prevention, vaccination for girls. They all need to come up. So
Yes.
we need to expand. There are vaccines available for now many other conditions where maybe the cost and the effectiveness. So the cost factor is always there. And then the infrastructure. We have shown that with COVID that we have an infrastructure, and if we really desire, we can reach everyone in the country. There is no doubt about the capability. So now that we have learned so much about vaccine, how to get to people, introducing and getting to newer vaccines in the population, I'm very optimistic. We'll be able to do it fast. We'll be able to do soon. We'll be able to do it fully, and more education will help everyone to accept those vaccinations. I have no doubt about the bright future about of the vaccination program in this country, and our ability to be able to afford all kind of vaccinations that are available.
Said it right, sir. COVID was a time where we tested actually on ground problem, or what we call the exercise, to make vaccine, so to invent vaccine, to reach out to masses, to get them vaccinated, and we did it. We were able to do that, and we did that. So your optimism
Yes.
is absolutely correct.
And you know the research part, the
Yeah.
we have learned over these years many ways of create vaccines. Initially, if you talk about the vaccination from the time of Edward Jenner, when the smallpox was not seen in those who were looking after cows, the observation itself that cowpox, if it has happened, smallpox is prevented. From that time, the immune response and immunity that had been studied. And then we found passive immunity with the serum, anti-tetanic serum, anti-diphtheric serum, all of them came. And then came the active immunization. So now that there were killed vaccine, and then we have live attenuated vaccine where organisms had been maimed in a way that they will not cause disease, but they will create the immunity in the body. So all these technology is now available to
Yeah.
build upon that to produce more vaccine for a disease that is dangerous. It will take much less time, and I'm glad we have many scientists working in this direction for diseases that we have. We have we have vaccines created for our own diseases as well. So
Yeah.
that for another time, but research need to continue. The money need to be definitely taken out. Education program need to go continue, and recognition of those diseases which can be prevented, those which can be uh, eradicated. That even though we need to continue to work on them one by one, like we are doing it for measles now. Can be able to do it for the other diseases later. So my optimism lies because in all these, because good government intentions, good government policies for introducing, that is the most important. The governmental commitment, the political commitment, then the resources they had been mobilized, and I hope that they will be continue to be mobilized. Industry, which had been responding to the need and responding to escalation of the technique for the so that populace, the general population is able to benefit from them. That what the Serum Institute did. And then educational program, general public's awareness, and then finally the role of the health worker who continuously advocate these. These are few strategies if we have, and these I'm sure vaccination to prevent diseases and build up a good health for the future is a possible is quite likely.
You explained that very beautifully, sir, to us and to all our audience out there. And this is a small initiative to raise awareness about immunization, importance of immunization, and how it will benefit each and every person present in the country, especially the child immunization, and how it will help our future coming in coming years. So thank you so much for that, and thank you so much for sharing your expertise and knowledge with us. It matters a lot, and I know your time is very valuable, and thanks a lot for all such of your expertise.
Thank you. I needed this was a time well utilized because I'm able to speak to many more than one patient at a time, which I would have
Yes,
done during this. So thank you
yes.
for the opportunity, and thank you uh, for letting so many people get this message. Thank you.
Thanks a lot, sir. Thank you.